Why has a top doctor been sacked by the HSE for giving his fact-based medical opinion on the severity of the coronavirus? Is there any room for dissent in this country anymore? This is Ben Scallan and you're watching Gript Media. Dr. Martin Feely of the HSE made a stir recently when he claimed that the novel coronavirus is not as severe for most people as the common flu. For having the audacity to state this view out loud, he has effectively been fired by the HSE's upper management. As reported by the Irish Times, COVID-19 is much less severe than the average annual flu, and current draconian restrictions are no longer justified, according to a senior health service executive doctor. People at low risk from the virus should be exposed to it so that they can develop herd immunity and reduce the risk to vulnerable groups, according to Dr. Martin Feely, Clinical Director of the Dublin Midlands Hospital Group. That is what is happening, and yet the policy seems to prevent it. This should have been allowed to happen during the summer months before the annual flu season to reduce the workload on the health service during the winter months. Dr. Feely says that while the initial measures taken by the government were totally acceptable and justifiable, this is no longer the case given what we now know about the disease. Now, Dr. Martin Feely is a vascular surgeon, as in a trained senior specialist in medicine. Until just a few days ago, he was the clinical director of the Dublin Midlands Hospital Group for the HSE. So this is not some random punter's opinion. This is a highly skilled and educated man with many years of medical experience. Not only that, but everything he said is rooted in fact. According to the World Health Organization, 80% of coronavirus cases are mild or asymptomatic, meaning they have no symptoms at all. The person that has the virus doesn't even know it. That's 80% of cases. Similarly, his claims about needing to allow herd immunity seem to be borne out by the data as well. Sweden didn't lock down its economy at all, and just the other day, The Guardian reported that their infection rates are one of the lowest in Europe. Meanwhile, many other countries are beginning to see infection surges that they haven't seen since the start of the virus. So whether you agree or not, everything he said is at least reasonable based on the evidence available, and yet, what was the reaction of the HSE? Well, they have effectively sacked him from his job as a result of his medical opinion. Most headlines won't tell you that, mind you. At first glance, according to most outlets, he simply resigned. But as the Irish Times article admits, buried several paragraphs in, Dr. Feely, 70, stepped down from his post as clinical director of Dublin Midlands Hospital Group on Tuesday with immediate effect. After his public comments, he came under heavy pressure from HSE management, who told him that his position was untenable. When your boss tells you your position is untenable, I think it's fairly clear to everybody what that means. Resign or be sacked. The choice is yours. So now we live in a country where a senior medical expert with a specialty in treating lung conditions can give his fact-based opinion on COVID-19, and he will be fired for deviating in any way from the accepted orthodoxy. No dissent of any kind is allowed anymore. After all, just look at Minister Simon Coveney saying that the government should look at people's right to protest. There's always a balance that the state has to manage between giving people the right to protest and be heard and to demonstrate, and at the same time ensure that law and order is respected. Someone should inform Simon that the government doesn't give people the right to protest, and it's not within their jurisdiction to take it away either. What kind of a country do we live in when a simple difference of opinion with the state or the authorities is enough to land you in serious trouble? Is this about science and evidence, or is it about the authorities silencing and punishing people, even medically qualified scientists, who have a different opinion? Because the line is starting to blur. Please like and share this video, and as always, if you enjoyed it, please consider signing up for a monthly donation via the link on screen to help us produce more content like this. Alternative media like Gript needs all the assistance it can get, and every donation goes a long way. As always, thanks for watching.